Care homes are the sanctuaries to safeguard the most vulnerable. And when dealing with the biggest viral threat of our time, for those inside there has always been a choice whether to be protected. But as of October, it will be illegal to work in a care home in England if you haven't been vaccinated against COVID-19.
Each to their own, but I don't want it forced on me against my wishes. It's wrong.
There's outrage from some like Andy, who are faced with a 16-week countdown, knowing it could cost them their jobs.
I've been tested every week, virtually since they brought the tests out, and I've been negative every time. And I've followed the restrictions as best I can. And I just don't want to be forced into the position of having a vaccine against my wishes. And it will mean I will leave my job if they do and try to put this through.
The law won't be limited to healthcare staff. Hairdressers and tradespeople will also need to be vaccinated to gain entry. Those in the care sector say it's a slippery slope.
Just removing a handful of people from each employer if they refuse a vaccination is going to give us enormous problems. So I agree with the vaccine, but forcing people and then having to sack them after all their hard work doesn't seem right to me.
According to NHS figures, 84% of eligible workers in care homes for older people in England have received their first dose of the vaccine. That means more than 75,000 haven't. Here in Wandsworth, just under 27% of care home staff who work with the elderly have not had their COVID jab. Vaccine hesitancy is thought to still be an issue, but there are also logistical problems at play, with odd shift patterns causing problems when booking appointments.
Quick Susie moves to the lever, Gary Carroll.
Residents of Gracewell Ascot are neighbours to one of the biggest races in England, but outside of their doors there's a global race between the virus and the vaccine. Here they're relieved all staff members are fully inoculated by choice.
After all, you're looking after sick people, or infirm people rather, so the more things that you help safeguard their lives, the better it is.
But it wasn't without its challenges.
There were difficult conversations, but it was about reassurance. It was never about bullying. It was about educating. It was about understanding why there was reticence, why somebody was maybe a little scared.
A consultation on the mandatory immunising of NHS workers in hospitals opens tomorrow. For the past 18 months, they have been saving lives. Now they may not get a choice on whether to potentially save more. Ashna Harinag, Sky News.